Our population is ageing, and already more than a quarter of people in England have a long-term condition. If things don't change, the NHS we all value will find itself with a funding gap of £30 billion within the next 5 years. At a recent Sustainable Healthcare conference, AbbVie, a new biopharmaceutical company, brought key stakeholders together to discuss the healthcare challenges of our times. Lucy Siegel has more.
In 2013, AbbVie, a new biopharmaceutical company in partnership with the College of Medicine, set up a steering group to develop a roadmap to more sustainable healthcare.
And today, both of those parties have convened another conference here at the King's Fund in central London, inviting some of the top names in healthcare to discuss progress.
Matt Regan, General Manager of AbbVie, launches proceedings.
Every 36 hours, over 1 million patients pass through the NHS. So it's the equivalent of a packed Wembley Stadium every 3 hours.
Actually, a lot of the challenges are due to the tremendous success of the healthcare system and the NHS specifically, because people are living longer. But with that are coming challenges where people are living with multiple long-term conditions. And actually, a statistic in England is that 25% of people are living with a long-term condition. So with that comes more demands on healthcare. And then when you couple those two dimensions, an ageing population and multiple morbidities, with financial austerity, well, then that means the stresses in the system. And that means there is a burning platform for change.
Dr. Michael Dixon co-chairs the Sustainable Healthcare Steering Group.
The steering group had a very important question to answer, which is how do we create a sustainable NHS? And right at the beginning, we had a blank sheet. So we had to start thinking, what are the various areas where we're going to have most impact? We've been learning about all sorts of apps this morning, online prescribing, patients being able to access their own records. All this, I think, is part of a cultural movement of empowering patients to look after themselves, which probably, if there's one theme today, that comes over more than any.
So that's the end of the first session, some very robust panel discussions. Nobody's sugarcoating the challenges to NHS England, but a lot of optimism as well. Let's see if the delegates share that optimism.
So I'm hopeful that, with the challenges that we're seeing financially, that actually it'll make us have some creative solutions.
I think I'm going to go back with new ideas about how we can allow patients to take ownership of their own care, but also about how we're going to get those doctors from the very early stage in their career to recognise the role of the patient.
The NHS has no choice but to make that step change.
AbbVie has also funded a number of pilot programmes crucial to achieving and informing change. The shared decision-making pilot has been developed by Professor Debbie Cohen, utilising her background research around health and work.
We've developed a shared decision-making tool, very, very simple tool around effective conversations around health and work, and we've been trialling it for 3 months, and the results are really very promising. All GPs have said it's enabled them to have better conversations. They've also seen a shift in how they write their fit notes, so they're writing less people off sick.
And more progress is set out in this new report, also launched today at the conference.
I'm quite excited that this actually helps address the biggest problem facing healthcare worldwide, which is the emergence of chronic disease. And what it says is we need to empower patients to self-manage. They live with these conditions, they need to be expert in the management of these conditions. And also, it points out that in a digitally enabled era, the traditional role of the professional as being the repository of information has gone. This is now accessible for everyone at their fingertips.
Normally in these kind of reports, they include everyone that is a healthcare provider, all the stakeholders, and then the patient is left out. So I was there to sort of say my bit, which was quite funny because they all talk in a language I don't understand, and then I would say, excuse me, I'm the patient, can I just say what I think? And when you look at the finalised report, it's fantastic because it is just totally patient-centric, which is what we want.